COVID-19 has reached and impacted almost all parts of the world. Just when we thought we were getting away from COVID-19, Omicron has emerged. Since it emerged in mid-November, Omicron has spread across the globe like wildfire. Though it has milder symptoms, same as a flu, World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease. There are reasons to worry about it. People with diabetes and heart disease can face severe complications. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes, Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. But if you have any questions you would like to ask them, please send them to us via WhatsApp to the following number. The number is on your screen. Number is +91 9167 666 941. That is the number to send us with your questions for our experts. Please also send us your name and your location. Today for our special show, we have with us Dr. Hari Kishan Boorugu, MD, DNB Internal Medicine, Consultant Physician, Diabetologist, Yashoda Hospitals, Hyderabad. Dr. Rohith P Reddy, MD, DM Cardiology, Consultant Interventional Cardiologist, Yashoda Hospitals, Hyderabad. And Dr. M. Kathiresan, MD, DM, FNB, FESC, FSCAI, Senior Consultant Interventional Cardiologist, MK Heart Clinic, Apollo Hospitals, Chennai. Thank you all so much, doctors, for joining us on this very important issue. Starting with you first, Dr. Boorugu, we have a WhatsApp question from our viewer, but I would also like to remind our viewers, please keep sending in your questions and send us your name as well. This question doesn't have a name, but it is from one of our viewers, and the question is, Doctor, I am 63 years and I am a diabetic and a hypertension patient. I had my third vaccination recently. Should I not take painkillers, and if yes, then for how many days?
Good evening. So after taking a COVID vaccine, minor side effects like injection site pain, a bit of swelling at the injection site, fever, body pains, that is muscle aches, sometimes severe muscle pains, a bit of giddiness or headache. These are minor side effects which are very common, seen in about half of the patients after vaccination. However, when compared to first dose, the frequency and intensity of side effects actually is much lower with subsequent doses. If you develop fever or body pains after taking a vaccine, you needn't put up with it. You can take simple painkillers like paracetamol that we commonly use for fever and body pains. You can take paracetamol 500 to 1000 milligrams 2 or 3 times as per your requirement. And you need to make sure that you drink good amount of water. So if the fever is very high grade, which is not usually the case post-vaccination, and if you have unbearable body pains which are not coming down with paracetamol, then you may take more powerful painkillers like ibuprofen, diclofenac, naproxen, etc. However, if your symptoms do not improve in 2-3 days' time, then it's better you consult a doctor. You may be dealing with something more than a side effect of a vaccine.
Okay. So I think it's an important point. Medication can be taken, but in case fever doesn't subside in 2-3 days, one must visit a doctor. Dr. Kathiresan, the Omicron coronavirus variant seems to produce milder symptoms and fewer hospitalizations than Delta because most people have been vaccinated. Is this true?
Yeah, greetings to all. Basically, a coronavirus is an RNA virus. It keeps mutating. Some people ask me why you are able to eliminate the polio virus, but you're not able to tackle the coronavirus. So polio virus is a DNA virus. Once you give a vaccine, it gives lifelong immunity and it does not mutate. Whereas in an RNA virus, it keeps on mutating and the vaccine effectiveness lasts only for a shorter period of time, 6 months to 1 year. So Omicron and Delta, these two variants, Delta variant caused the second wave. Compared to the Delta variant, the Omicron variant produces less severe disease, but spreads faster. So transmissibility is high, but the virulence of the disease severity is less. So irrespective of the vaccination, generally it causes less disease. But having said that, vaccination as a whole is a very important phenomenon, and vaccination gives a layer of protection for all variants, and The newer variants will have less effectiveness for the original COVID vaccine, and the research is going on to produce variant-specific vaccines, which will be coming up in the later part of the months to come or weeks to come. But generally, as you said, Omicron causes less severe disease than the Delta variant.
Less severe, but vaccination is still key, and of course maintaining all COVID protocol, that is key as well. Dr. Reddy, we have another WhatsApp question from our viewer. The question is, if a person is Omicron positive and has a cough, do they need to take antibiotics, and what would the course be of treatment?
Yeah, a very good evening to one and all who is present on the show. So like Dr. Kathi has already mentioned before, so coronavirus or COVID-19 is caused by SARS-CoV-2 virus. It is a virus. Hence, antibiotics have no role in the treatment of a viral illness. Though there may be certain conditions which we call as secondary bacterial infection. So when the virus infects the respiratory tract, it can cause some damage to the respiratory cells and epithelial cells in your bronchi and the respiratory system. So where it can be, they can have secondary infection with bacteria. So that is the only time when we have to use antibiotics to control the bacterial infection and the bacterial proliferation. Inadvertent and irrational use of antibiotics can lead to the development of resistance to the antibiotics, and in the future generation we may not have sufficient antibiotics to treat these illnesses.
Yes, I think that's another
And
very important point.
Yeah.
Were you saying something? Please go ahead.
Yeah, cough can be treated simply by symptomatic treatment, either with cough suppressant cough syrups or antihistaminics. And if the patient has any fever, then we have to give a paracetamol that is sufficient for most of the patient with mild symptoms of COVID.
Okay. So, I mean, cough medicine can be taken, and not to over-medicate or self-medicate. I think that's another point which you were, which is very, very important. Dr. Boorugu, people are still unaware of the importance of regular blood sugar monitoring. They think that they will get symptoms and indications if their blood sugar rises. Can they also experience blood sugar rise without any symptoms?
Yeah, thank you for this. Thank you for asking this question, because this is a very important question. Most people have this misconception that if they do not have symptoms, their sugars and blood pressure are normal. They assume that it is normal. So most people with diabetes or people with high sugars, unless the sugars are very high in the range of 400, 500, they often do not have any symptoms. Okay, so the so-called classical symptoms of like increased thirst, frequency of urination, that happens only if somebody has sugars in the range of 400, 500. So normally fasting sugar should be below 120. After food it should be below 160. Even with 200, 250, 300 sugars, most patients don't have symptoms, and that's the reason why many people don't, because of this misconception that if they don't have symptoms, they are unlikely to have diabetes. They don't check even if they have family history. That's why there is so much of undiagnosed diabetes burden in our country. Even people who are known to have diabetes, they don't often check sugars, thinking that they don't have symptoms, so their sugars must be all right. And that's a misconception, as you've rightly mentioned. And unless we check sugars regularly and keep them under good control, like I've mentioned before, the levels, what are the normal levels, and there is something called glycosylated hemoglobin, which reflects average sugar over the last 8 to 10 weeks, and that should be kept under 7. Only if we do that, we'll be able to prevent complications associated with diabetes, like heart problems, neuropathies, or eye problems, kidney problems, etc. And if you wait for symptoms to develop, that means we are allowing the sugars to go too high, and that's too late.
Yeah. So we shouldn't really wait. I mean, it also leads to complications, and sometimes, like you rightly said, it goes undetected. So it's important to keep sugar levels in control and keep checking it. Dr. Kathiresan, we have another WhatsApp question from our viewer. What should be monitored while doing exercise to avoid heart failure, heart attack, or a stroke? And what indications are to be monitored to be on the safe side?
Yeah. So this is again a very important question. We have to divide into two parts. So before starting an exercise program, what should be done? So, and during the exercise, what should be taken care of? So before doing a very intensive exercise program, or when you are starting an exercise regimen, when you are more than 40, when men more than 40 and women more than 45, we generally advise to screen for the heart as well as the blood investigations, which we call the muscle checkup. along with blood investigations, ECG, echocardiogram, and treadmill test. And because absence of symptoms does not mean absence of disease, heart has a very compensatory phenomenon. So there is a latent period where the disease is developing, but you do not get the symptoms. So it is very important to detect the disease at that early stage, as my friend Hari Kishan said. So, and during the exercise, if you get an unusual chest discomfort, you get unusual breathlessness, and if you get very low sugar symptoms like giddiness, then they have to be given importance and you have to consult your doctor. And the other important parameter we ask to check during the exercise is your heart rate. So usually the heart rate goes up during the exercise. It can go up to 140, 160, 180, depending upon your exercise tolerance. But generally the cutoff of 160 to 180, we have to be very careful. So before starting an exercise, go for a muscle checkup, check your basic parameters, and during the exercise, check certain things. Thank you.
Okay, and I think like what you said about the heart rate as well, and regular exercise, regular checkups is of course key here, which we've understood, after this conversation as well. Dr. Reddy, can shortness of breath be a symptom of a heart attack or any type of heart complication? What test should a person do in this situation?
Yeah, shortness of breath is a very important symptom, and it can be a major symptom of heart problem. So New York Heart Association gives 4 classification of shortness of breath, or dyspnea as we call it, starting from class 1, which is the mildest, class 2, class 3, and class 4 is the most severe. So class 4 dyspnea by NYHA means that the patient has shortness of breath even when he is at rest or when he is lying down and is not doing any activities. So this is the most severe form of dyspnea and can indicate the presence of heart failure in a patient. So now shortness of breath even when the patient is at rest, and swelling of the body with swelling of the feet, swelling of the face, and abdominal distension are all signs of heart failure. Heart failure occurs when the heart is dilated, and because of which the heart is unable to pump enough blood which is sufficient for the entire body. Other than this, there is one more form of dyspnea, which is class 2 or class 3. In patients who are diabetic, most of them do not present to us with chest pain in the case of myocardial infarction or in the case of unstable angina. So because in diabetics there is damage of the nervous system, hence the pain perception is less, and they may present with shortness of breath. So basic investigations such as an electrocardiogram or a 2D or 3D echocardiogram is sufficient for a diagnosis whether the patient has heart failure. In case we have to diagnose coronary artery disease in a diabetic patient, we may have to do a stress test, the most simplest form of which is treadmill test. So if the patient has reproducible symptoms, that is shortness of breath, along with changes on the treadmill, then it is suggestive of coronary artery disease, and he may have to undergo further investigations such as coronary angiogram also.
Okay, thank you for explaining that really well, because one should not take any symptom lightly, and of course tests are key. So on that note, we're going to be taking a really short break. We'll be right back very soon. Welcome back. You're watching Beat Diabetes, Myths and Facts. Starting with you, Dr. Boorugu, people with diabetes have an increased risk of developing a number of serious health problems. Which are the most serious and life-threatening complications associated with diabetes?
Yeah, diabetes is associated with many complications. Some of them are acute, that they happen suddenly. Some of them are chronic complications which develop gradually over months and years. So one of the common complications or problem the diabetic patients face is hypoglycemia, that is low blood sugar. When the blood sugar goes below 70, and that usually occurs when the patient takes excess dosage than what is required, or takes his regular diabetic medication but skips a meal or eats much less than his usual amount. So when the sugars go below 70, they can pick it up because there are certain symptoms they are likely to have. They may start sweating excessively, they may have palpitations, they have increased appetite, they feel anxious, they may feel giddy. However, if the sugars drop further, let's say below 40, then they may become drowsy and they can become unconscious. At times they throw fits also. It's a complication that is very common among diabetics because of inappropriate treatment. So it's important that they have regular meals. They have to have small frequent meals and then monitor sugars regularly, be in touch with their doctor, adjust the dosage of medications in order to prevent this common complication called hypoglycemia. Another life-threatening complication is diabetic ketoacidosis, wherein the patient has very high blood sugars, the acid levels in the blood increase. They have something called ketone bodies that appear in urine.
Okay.
The common symptoms are basically patient has extreme weakness, amount of abdominal discomfort, pain, vomiting, and the sugars are usually in the range of 300, 400. And it's a life-threatening complication if not diagnosed promptly and attended to. It is life-threatening. And of course, there are other complications like heart problems, heart attacks, heart failure. That we know the diabetic patients are at increased risk of developing heart attacks, at increased risk of developing brain strokes because of there are blockages in the blood vessels that supply the brain. Like people with heart attacks, they have blockages in the blood vessels that supply the heart.
Yes.
Similarly, they can have blockage problems in the blood vessels that supply our legs, and they can have gangrene. Everybody knows that people with diabetes, people would have heard that they develop gangrene because of a lack of blood supply to a particular foot or leg, and then sometimes it ends up with amputation. And similarly, there are other complications which are not life-threatening but are very discomforting to the patient. A common complication is diabetic neuropathy, wherein patients complain of numbness, some pricking sensation. Sometimes they have loss of sensation, hand and feet. Even that can be though it's not life-threatening, that
But
can
still
be
there are complications.
That cause a lot of discomfort and loss of sensation, lack of sensation, hands and feet puts them at risk of ulceration and infection. So that again can lead to a serious problem.
So serious problems, and even if not life-threatening, like you said, there are many complications, and that is why the reason is that diabetes needs to be managed well holistically. I mean, it's all about managing it well. Dr. Kathiresan, having a silent heart attack puts you at a greater risk of having another heart attack, which could be deadly. Why do people with diabetes experience silent heart attacks? Because many times the patient doesn't know that they are getting a heart attack, and that is what is risky.
Yeah. So this is a very important concept to understand. So a heart attack means a 100% blockage suddenly develops in one of the blood vessels of the heart. So we have 3 blood vessels supplying the heart. Suddenly you develop a 100% blockage. Usually it causes chest pain, but in the long-standing diabetes, the nerves to the heart do not work. Also in certain people more than 70 years, the nerves do not work well. So these 2 categories of people get a heart attack, but they don't get chest pain. Luckily, they develop other symptoms which has to be given importance. Like the most common symptom is, like my friend Dr. Rohith said, breathlessness. If you develop unusual breathlessness at rest, you have to take it as an equivalent to chest pain. And the other symptom is unusual fatigue, unusual giddiness. These symptoms also have to be given importance.
Okay.
And the other important thing is one silent heart attack and you do not recognize, and your pumping function of the heart comes down, and you develop breathlessness, and it is very difficult to treat. So again, you go with the second heart attack. So that's what we have to go for. You emphasize the importance of periodic checkup. Be alert to your symptoms, but do not get anxiety, giving importance to each and every symptom. Sometimes people go for anxiety. So some certain symptoms you have to ignore. At the same time, certain symptoms we have to give more importance.
Okay. Yeah. I think what you just said rightly, right? Be alert about your symptoms, know about it. There should be awareness, but one shouldn't take stress or, have anxiety. I think that is, again, something very important to keep in mind. Dr. Reddy, angioplasty or bypass surgery, is that the only option to treat a heart attack? How safe is angioplasty, and how many years do stents last?
Yeah, and this is a very important question which we keep facing every day from all the patients actually. So basically, a heart attack means that the blood vessel which is supplying blood to your heart is totally blocked. So it is 100% blocked. So basically, for the heart to survive, we need to establish the blood flow, which is a form of what we call as revascularization. So revascularization can be of 3 forms. One is medical therapy. In earlier days, before the advent of angioplasty and bypass, they used to give this medical therapy called thrombolysis, which is a powerful agent which dissolves the clot in your blood vessels. But also, because of this agent which dissolves the blocks and clots in the body, there is a high risk of bleeding elsewhere in the body. So after this was the advancement of coronary artery bypass surgery and angioplasty, or which we call as placing a stent after we clear the block either by a thrombus aspiration or by balloon angioplasty. We place a stent to maintain blood flow to the area which was earlier blocked.
Okay.
So the technology and advent of the stents has been tremendous in the past few years. Earlier, we used to have just what we call as bare metal stent. And nowadays, we have what is called as medicated or drug-eluting stent, which is first generation. And now we have reached the second generation of drug-eluting stent. So the process of angioplasty or stenting is very safe.
Okay.
And the risks are also very less. And the risk of mortality is less than 1% or hardly 0.2 to 0.3%. And other minor complications such as slight bleeding from the local site and other complications is also less than 5%.
Okay.
And the second generation drug-eluting stents with the latest design and the drugs which they are eluting, that is everolimus and zetorimus,
Okay.
are found to be very safe. And the patency rate, or the instant restenosis, what we call, is that means these stents can be blocked further in the future,
Sure.
is only around 5 to 10% at the end of 5 years after putting these drug-eluting stents,
Okay.
provided that the patient takes his medication regularly and his other
course.
comorbidities such as diabetes are under well control, and he should modify his risk factors such as smoking and alcohol. All those have to be put under check.
Yes, of course. I think it's important to keep all that in check as well. Thank you so much, doctors, for joining us and sharing all this with our viewers and all of us. Thank you all so much. NDTV 24/7 News will continue on the other side.